Can missing the tPA window impact stroke recovery? When it comes to stroke recovery, timing is everything. Missing the critical time window for administering tissue plasminogen activator, commonly known as tPA, can have a significant impact on recovery. tPA is a medication used primarily for ischemic strokes, which occur when a blood clot blocks blood flow to the brain. The effectiveness of tPA is highly dependent on how quickly it is administered after stroke symptoms begin. Ideally, it should be given within 4.5 hours of symptom onset. Why is timing so crucial? Once a stroke occurs, brain cells begin to die rapidly, about 2 million brain cells every minute. This rapid loss of brain cells underscores the phrase, time is brain. The longer the brain is deprived of blood flow, the more extensive and irreversible the damage becomes. The optimal window for administering tPA is within 3 hours of the onset of symptoms. Some guidelines suggest that in selected patients, treatment can be effective up to 4.5 hours. Administering tPA within this timeframe significantly increases the chance of a favorable outcome by improving blood flow and limiting brain damage. As time passes, the effectiveness of tPA decreases. If treatment is given within the first hour, the chances of recovery with minimal lasting effects are the highest. Between 1 to 3 hours, tPA remains effective, but the risk of permanent damage increases. Even if treatment is given between 3 to 4.5 hours, it can still be beneficial, though with reduced effectiveness. Beyond 4.5 hours, the risks of irreversible brain damage, severe disability, and even death increase dramatically. In fact, tPA is generally not recommended after this point due to the lack of benefit and increased risk of complications. Patients who miss the tPA window often face worse functional outcomes, higher rates of disability, and increased mortality. Early treatment is linked to better chances of regaining independence and reducing long-term neurological deficits. While some studies have shown that extending the tPA window to 4.5 hours can be safe and beneficial for certain patients, treatment beyond this timeframe is not standard practice due to the heightened risks, such as bleeding complications. The practical implications are clear. Recognizing stroke symptoms quickly and seeking immediate medical attention are vital for timely tPA administration. Delays in reaching the hospital or diagnosing the stroke can significantly reduce the likelihood of receiving tPA and worsen recovery prospects. In summary, missing the tPA treatment window usually results in poorer stroke recovery outcomes. This is because the opportunity to restore blood flow and minimize brain injury is lost. Prompt treatment within the 4.5-hour window maximizes the chances of favorable recovery and reduces the risk of long-term disability or death. This highlights the importance of rapid stroke recognition and emergency care. Always consult healthcare professionals for personalized medical advice, as individual experiences can vary significantly.